Good morning, everyone. Welcome to the webinar on COVID-19 and gender equality, psychosocial, emotional, and professional challenges faced by women, which is organized by Equity and Inclusion Committee, Government Champhai College. My name is Rebecca Lalmingmoi, Assistant Professor, Secretary, Equity and Inclusion Committee, Government Champhai College. There was a slight interruption due to power supply. Therefore, we couldn't start the program on time. Sorry for the interruption, and we apologize for that. Today, I wish you all to have a good time. Also, we are privileged to have an expertise and experienced resource person. Dr. Lalremruati, Government Aizawl West College, is joining with us to share her valuable knowledge. Thank you, Miss. To begin our program, I may now give time to Dr. Elilal Lianpui, Assistant Professor, Working Chairman, Equity and Inclusion Committee, Government Champhai College.
Good morning. I am Dr. Elilal Lianpui, Assistant Professor, Department of Education, Government Champhai College. As a working chairman of Equity and Inclusion Committee, it is my pleasure to welcome all the participants today for this webinar on COVID-19 and gender equity, psychosocial, emotional, and professional challenges faced by women, which is organized by Equity and Inclusion Committee of Government Champhai College. I extend a very warm welcome to our resource person, Dr. Lalremruati, Assistant Professor, Department of Psychology, Aizawl West College, who has agreed to share her knowledge, expertise, and her vast experience. She is currently the coordinator of Psychological Counseling Group under COVID-19 Committee on Psychological and Social Guidance, Government of Mizoram. We really appreciate your effort and commitment to make this webinar a success, ma'am. Government Champhai College has organized this kind of digital platform several times in the past, maintaining the social norms due to COVID-19 pandemic. Thanks to advancement of technology that we can meet and share knowledge without actually having to meet in persons. The theme of this webinar, as we know, is COVID-19 and gender equality, psychological, social, emotional, and professional challenges faced by women, which I feel is very interesting and appropriate because the impact of crisis is never gender neutral and COVID-19 is no exception. In fact, women seem to be more burdened by it. Women seem to be more hit hard, I should say. We are proud to have been able to organize this webinar with a well-known and expert resource person working for the cause of women as well as for the general public of Mizoram through various NGOs and expert bodies. I once again welcome our speaker and participants for sharing your time for this webinar. Let us hope to have a fruitful and interesting time together. Thank you.
Okay, thank you very much for the lovely welcome, Dr. Ellie and her team from Govt Champhai College. Thank you for inviting me to share my passion about mental health. Basically, I'm a clinical psychologist, so my first love is always mental health, and I'm always willing to share my experiences as well as anything to so that and anything where I can help other people to become mentally healthier, I would say. So thank you for this wonderful opportunity. So today I think I have about 1 hour with you. So let's hope we can use that time fruitfully. I'll be sharing a PowerPoint presentation, which I have written everything in English, but I will speak in English, Mizo, so mostly in Mizo. That's how I'll be presenting my my lecture or presentation. Let me just share my screen for now. Okay. So today's topic that I have been given is called COVID-19 and gender equity, psychosocial, emotional, and professional challenges faced by women. So just so that we can understand, let me just fill in a little bit gap about my experience with women's studies. In the 12-year plan of UGC, there was a particular workshop called SAM workshop, which was called Sensitization, Awareness, and Motivation for Women Managers in Higher Education. So I have had the opportunity to learn in that SAM workshop and also had the opportunity to be one of the trainer associate in Mizoram. I think it was just about 3 at first, and then later on there were more. So I was in the first batch. So I had the opportunity to study more about gender issues, basically on women managers in higher education. So that is something, so because of my experience with women's studies, there are many professors, especially, the women's studies group in Mizoram University tend to believe that I'm very like pro-feminist or, very pro something like that. But I'm not really, I would call the bra burning kind of a feminist person, but I'm of course into the gender equity part. So therefore, like anything to do with the women issues, if the term gender equity comes into the area, then I never really shy away from the topic also. So before we begin, let's going into the COVID-19 situation, I want to talk first of all about what we actually mean by the term equity, and then we also tend to use the word equality. Equity le equality so kan mang kopo chin ta like equity le equality omzia he shat hamte he angeni kan lo shat pol fo ve chin ta so be headline po alem he kan enswanin alema po hianin equity le equality danglam na lai hi aron lang chang memin ka sia alema hianin equity kan ti khaswanin. This is about being fair more to both men and women. Just like swanin I allow kan bul chan naka allow in ang law ani me theya so wang swanin at to pa opportunity ka in ang dong chin ma ila kan bul chan na la ya khanin har sat na te kan lo to te emo hardships ani emo financial constraint ani emo kan gender wang har sat na kan lo tok te ni emo khatya kan bul chan mun kha in an swan si lo swanin atopa equality lova don ringot la ya khanin omja ka ani lo chin ta so wang chan dom ngai te dom kan ngai huna kan dom kan ni na te khanin equality hun kha kan thleng the do so don ani ti la ya kha atar lang le ka sia alem hianin chu alem hi karanda te na than kher po ani equality kan se chin amaro si equality a khaswanin ni equal opportunities atopa kan lo dong po ani me thei amma ro so kan bu chan na la ya kha ai an chuan si lo kan background te kan lo zeilen na bo rock te ni alo kan sum le pai din hun te ani amo kan zerna din hun te ani amo khang zong khanin alo omja atopa opportunity inang lo dong ma ila khang zong khanin khang opportunity but mu theina chance kha dang khan dang lam na aron hen thau si awangin equity hi ngai poi mo zong ani thau ta yaw ne ni This one in gender inequality kan ti one in inequality around thenta ka si one in her sat na lo thing kan ti one in basically the first thing is always about having the disadvantage in decision making. Tutlog na siya ma hianin thu her MMA ta atu ta ton thu kan ti akhanin mani thudu lampang kan sei na anilova amar so mani ta na chale mani ta na changkai to le kan maso na tu ra ta na thutlog na siam to po a mani thu nei mi alo khanin har sat na an ta ki alo hlen ta chin ta so chuanin I alo kan maso na to ra bi po kha aron ti chuan of chin MMA ni tin la to ta chuanin disadvantage in economic and social resources ta so ta po chuanin mi pala nei cha into plan na la ya khani ade alo har sat na alo amani kha chuan book tok tur in book ton lawa lo si kha chuanin kan sum le pai din huna te kan khotlang cheve la kan thil don son the na tura te po han har sat nin than the boko of course power imbalances ka ni le ta potta tin less autonomy poi mo MMA ni he independence kha I kan nei he thei lo chin ta ni he la hanin kan mi pa tam tak te po khain om ni ka ringa gender studies a hianin or women studies a po hianin atam pakistan kan ngai dana chan me chetanga lom me chethil ti om to kan ni me che ho in ro ase ti anita amar ase me chia te hi I allo kan lo tang kan ve a kan lo ma kan lo son ve a dom kan kan ni theina hianin mi patel lo hianin khang rong to ka thlem the chang lo ni to wang men are very much important in being sensitized about gender equalities or gender studies or even women studies. So I have seen many men who have actually been very, very passionate about women's studies and actually taking part as well as being faculties in women's studies department at the point on bokaniti hakan sha the poimo hakan mi tan sa wanilian lavaniti la hakan settle do lokani box tin ba ka hemi economic resources tung sang a po health space out do kan do so one time when we had done a very, very short survey research while in our refresher course kan kalin women studies a hian ka kal to a so ta chuanin me chia entrepreneur te I alo mi zo aizole mi ho kha kan zirani ta chuanin I alo kong tam taka chuanin me chia entrepreneur se kan lo jena na ka chon dor kai te tumdong me chia mo alo nula te nu te alo upato tak te chang ta kan interview kwalani ta chuanin I kan thil mu a chuanin interesting de me to a dor kai te a business run to te kha me chia an ni mo nge me na ma se an dor kha tu mi nge om ti te kan zota tin an dor chungpa nga bungrolak chungpa nga te tu nge thu ti te kan han zota tin I alo an sum le pai lak lua khanin an du angin an mang theyam ti te an mo hona tan en tin an mo hon en tin an du zong le tan te le na tan te en tin an tere le nan te emo thom no le nan te emo tu nge thu han ti zong ka zo kana ka han zo khanin adora kha ran ma an ma ran tu tak an mani ni ma se ador ni tu tak ming kha tu an pasal te an pu te an pa te khachang khanin atam MMA ni tam zo kha alo ni an mani ning om kha alo tle MMA ta tin mani ning ador ni te po kha an sum le pai din hun te an bungro nei te in alo abi te kin in le lawan neyam ram te an neyam te zo na ka han zo khanin atam zo khanin I alo ta po chuanin low nei te po khanin low nei ho po khanin most of their properties most of their bank accounts were in the name of either their husbands or their fathers or their grandfathers or their grandmothers so we hardly see a money group we hardly see women who were actually being quite autonomous in their financial situation. So one thing that I argued with one of our I actually argued with one of our teacher there. So they said it was a very good thing to see that many women are running their own business, and and it's a good thing to see that they are quite independent in their way of handling the situation, handling their business, and so on and so forth. But my argument is still this, that when a woman is not financially independent, she will never be truly independent. That was my argument. And I still believe that is being true, because when a woman is not, free, or when a woman cannot decide on her own about using her own hard-earned money and then it's going to be very difficult for her to i alo khatang tan khan har sat na kan sa ta khan a thlen thei do na shat na ke ma chang kala nei fan na so I kan se tel lo kan I so ma chang gender inequality a khatani disadvantage in economic issues kha alian eliminate like ka sai do wa tin ba ka economic issues singa tin ka ban se len zo ka te san because economic issues are khatani that comes power imbalances that and hence what comes the less autonomy more independence chung nga te independent care la lam pang ka saya kha ni ma ni ding out to yang pang ka sei na ni lo ba amaro so ma ni do zong te ma ni ngai dan te ma ni thir dan te ma ni again ni ma sona tura ta na malak te kha ang chi zong zong a kha nin ma ni ta na chatur po ngai to hlei thei lo khopa ngai to changam lo khopa I allow power imbalance ka on the thei ni ti lai kan sei zo ba kan so of course coming to gender equality chung sa ka chanin kha ani ta me ya this one is status of women hi hankal le ta ila what we have seen so far this is like a statistic taken from many websites from many websites I would say so what has been seen is that nearly 60% of women around the world they are working in the informal economy earning less saving less and at greater risk of falling into poverty and itani he him pe din mun and itani informal economy kan tikaswale heta po hianin formal institutions either informal kan tikaswale internet cleaners anga te po yang su mo tin I allow household household by tu te hote te ang ti shang shang ka anita ta swanin kate ang din muna na tho swan ani ta ka swanin it's very difficult I mean you don't really get paid very highly more so man a pay ka salary a changai lo ni la kang queen so man swanin hey ni tani and why are more women working in the informal economic institutions kan ti swanin basically here it has to do a lot with education because education swan si lo ka swanin nasang tho na chance ka at nyam tani so like as an education constraint for hianin and man hey Mizoram situation so ka clear level to na hian we are hearing the world more that the taila so I mean so me chat so me pa I to internet api taking when a family is having a financial hardship and they have a son and a daughter and payroll say usually the parents will always decide on the boy on the male child to continue his studies whereas the girl child will be asked to pour in some money by working in some house as domestic helper or tea stall things like that so this is a situation ni tani so financial constraint of napiang asa ni pala ni cha fa te anlo nei swanin the girl child is always the one who has to suffer like a thiam zo ka mo like a sir sang so ka poni ma se I allo se ka ani nga ani sang lem da ni tumi wang swanin ani poka the education a po hianin ni cha ka anlo hiam chin ta and then lesser education don ne na la ka swanin na sang zo wat mo na chance ka anyam ta chin bok ta ni and to san here ran chen there so poverty hani me ya ha na sumle pai har sat na ka ran chen lo thei lo ni and then women earn 23% less than men globally and they occupy only 24% of parliamentary seats worldwide thuklok siam na tura thei chanin the parliamentary seats tan phei a claim me 24 seats kan ta and 1 in 3 have experienced physical or sexual abuse and more than 200 million of girls or women have suffered genital mutilation. I don't know whether you have heard of genital mutilation. It has a lot to do with the cultural practices. Now 1 in 3 to asangani mi pathum zela pakhat mai chia mi pathum zela pakhat chan they have had experiences with either physical or sexual violence kan sihan I'm also including here emotional abuse po ka atel kan ni ka shat to ni of course neglect po atel ni ka shat po mo ani and the women rights son in aron ken tum kan ti equal pay tenita equal sharing of unpaid care and domestic work tenya and all violence against women and children and girls and then have equal access to healthcare services. Now these are very, very important healthcare services and coming to a little bit about mental health because we are talking about psychosocial consequences of COVID-19. I want to go briefly into what is mental health and what is mental illness. So when we talk about mental health, it is characterized by mental functions that result in productive activities, fulfilling relationships with others, and the ability to cope or change with adversity. This is very, very important because mental health can being productive มาส่วนเทนตัวตาในนุนเลยค่ะตัว mental health ในตัวอันนี้ mental health ในจะส่วนมาส่วนนั้นเทนตัวนุนค่ะอันนี้นี่จีค่ะอันนี้ไม่ตาที่มีดังแต่เนี่ยนะอินการะบวกชันเนี่ยค่ะ relationship ในชัดค่ะ so I'm just relationship กันที่เห็นไงจงเตว่าช่วงที่เรากันเสียจังเราตาเกี่ยมาอันนี้แหละมีดังเตเมื่อค่ะเนี่ยกันขัดล่างเตกันโกชนะเตกันโถนาเตกันกล้าสาเตกันอย่างคันที่ตามีดังแต่เนี่ยนะบวกชาบันนี้เทนอะไรกัน mental health อันนี้บอกตาที่ดังลำนั้นเต change เตอันนี้ดี situation กัน environment ดังลำนั้นทุกๆแต่รอนแข่งมาเสบ่อยแล้วว่าแล้วเป็นเสียงเรื่องดังลำนั้นดังลำนั้นรอนแข่งอักเตแล้วดนสันเทียมาให้สมิตรพอแล้วตอดเทียแล้วตอนเทียมาที่แล้วเป็นเสียงเรื่องเวทในลายค่ะที่ mental health มันอักโกกันนี่so it is totally different from mental illness ค่ะกันที่เห็นแล้วใช้กันเชียso mental illness กันที่ส่วนนี้ illness นั่นนะเอาไปเห็นตัวตาตัวตาส่วน diagnosable mental disorders อันที่เดียวแค่ diagnosable diagnose กันที่ตอน doctor เตะหมอ clinical psychologist เตะเจอวินะ undiagnosed เฮ้ฮันนี่ตานี่เอ็นเตน่าเฮติลายตัวหมอเราBS psychology ก็จะที่ว่า depression นี่เราที่เรียนว่าคันค่ะ depression kan rin to laban iti kasya turani doctor tingayin amo azrazil thwa clinical psychologist tingayin na azrazil thwa kher ka tile ba kala tun laya chani azur lem lo into clinical psychologist te an pam chauta em vai team ko hi angaya tin hetilaya achuk lama tanga ka don ti me ba lo ti poka kan pom te jam chang lo ni te poka sha to poi mo ani so ban chanin depression te anxiety te ni lo ti me le ri mat kha adik cha lo ta a doctor te ami cham tinge azrazil mi te kha ni ina I ala he chu mi to ani an ba ti the thap ni tura an ba ti the thap ang ti ho zo song kha ani ti ha shatter le taila diagnosable mental disorders ati da kharani tin chu chuanin har sat na an nun na an ngai to na te an mu da te an chet chwa da na kan behavior ati dang lam na sa tak aron khena khan hong na sa tak an khena khan so mental illness in the so mental health mental illness is different all right so mental illness kan han say lang ka uta poi ma te ne major it is very much associated with a significant burden of morbidity and disability thina athen me ba ka disability ti thei to lo na mo har sat na kana sa takin nun har sat na te chwa nei thei lo na la ya kha aron thlen ta tlap nei ta ni tin mental health problems it has become very much of public health importance because mishing ariru adam lo chuan mishing ariru anat chuan anatho atibuaya a in atibuaya a hriselna a ngonga amut atibuaya tin anat antin mason theina turnun aneya kha atibuaya anat to productivity kha atlatniam me ta ni to ama tan to poi te lo kha ni anatho na mana tan to pan apoi ta a khotla nga om na mana tan apoi te em ta to wang tan public health importance ani thot me ni mental health mi malakha adam phat angai ni ram adam na tur ta jan mi mal kha adam angai ni khwa adam na tur ta jan chung kwa kan dam na tur ta jan mi mal kha adam ma a him kha apoi mo me ni to wang tan mental health kan na itha the ngai lo bani ti la ya kha kan se na le to ta and mental health problems have also been found to be one of the largest causes of lost years of quality of life and itani so accounting for 10.5% of all disabilities and mental health problems fangin alo theng ti nani so so coming to women and mental health so women they have been known to be the integral to all they have been known to be integral of all aspects of society and they have multiple roles we cannot doubt that the allow no metia in a role tam tak anei la ya kha kan thei lo ta chutlai ka ra chuanin machine ve tho ani so one pressure kha adong la sabe me te kan sha to poi mo ani and basically women are chuanin we have to be we have to fight gender discrimination all the time and the associated factors of poverty hunger malnutrition being overworked domestic violence sexual and reproductive violence all of this kha may chia chuan a face na chance kha asang nei ta ni domestic violence po lekin na ko say zawanga reproductive violence te po mi pa da chuan in alo reproductive angani issues kha an nei ide lo kha ni ta me chan ani bi kan ni ta chutlai ka ton a vulnerability kha that na chance ani na chance ka ta sang member kan te kan sha ta poi mo ta ni and of course failure to address women health and mental health problems has damaging, adverse social and economic consequences for the community. And then we also have to understand that women bear the responsibility of being associated with wives, mothers, carers of other people. So this is the role of a woman. So the role of a woman is never, it's never enough to put to just one area or just two areas, because once a woman is around and then think of of you, those who are not married. I'm not even married. So, but then what we all know is that we all have mothers. So when we have mothers, I'm sure most of you also who are attending this program, when you think of your mother, or when you go out of your house, and then when you go back, when you go back home, the first thing I'm sure you must be looking for is usually your mother. When you are sick, when you are not feeling good, who do you call? Your mother. And then when you feel happy, when you want to talk to somebody who can understand you. So usually in the Mizo society, I'm not demanding the father. Okay, but this happens everywhere. It's quite common that we tend to look at our father or our mothers more than our fathers. So no te hik and ngai pa mo maniti laya ka kan se do. And then so wansanin so pe do zong ni la, we go to our mothers, not really our fathers. So so the mother becomes the cook, doctor ni boka, I alo rong bol tu ni boka, mo jang kanin I alo nu ka role at song hi play ni. So the mothers out there, you will know what you actually are to your family. So increasingly now, women are becoming more and more essential part of the labor force because of course, we are like development a local thozela ma kan lo son zela just like a rat pang kan nei min lo should be a delta ka so ani me tia po mani infona na thokha kan tam thot e men nei ni tin I allo he hi chu I tang kan nei na ran ken tel ni pa for min I financial constraint ba yin lo thei la ba nu te na ba tho ta ka kha po na ba na ba tho ta ka kha ngai ta pasalte na thok thei lo te ma pasalte ange rin tura lo rin klak tura an lo lo kha swani nu ina agent de bazan lob lo agent na but lob the ka alo ngai chau te mem bokani ti la ya kha kan se tel do boka. And then women and mental health issues, see, it's very, very common because what has always been seen time and time again, it has been proven that depression and anxiety disorders very much higher in women as compared to men. So hemi diagnosed and yaka say ka depression and anxiety disorders are quite na po the allow kan sha tira changin mecha in hai har sat nahi anne tamzo kan ni pa INT anita. And then women are also likely to receive like diagnosis of obsessive compulsive disorder. This is type of anxiety disorders, somatization disorder, panic disorder. So obsessive compulsive disorder kan ti ton thil ngai to ngut ngut alo obsess big mo ngai to ngut ngut amo kan te thwa te boy vet ka ti phat lo ton eng mak ti thil dang ka ti thei lo ti ang sia ngai to na ngut ku han nei ang ti te somatization disorder kan ti chuanin taksa na ne no nei enga mo har sat na nei phat me taksa na sui reng me tung na te pum na te lu na te I ti sang sang na yanga ama ro chu I alo doctor in NTO China, they test the strong test the scanning at the kati and younger testing and test na masi engma muthe jang box silo la chavek box ti masi amaka adam silo bani ti ang ti ta kha khatana na ta paka nei jan asam em ta tin panic disorder kan ti swanin I allow thacham don on me or achana swani thacham angeni thole thelo topic em me chana swanin heart attack te nei don ta mani ti nei to khopa boina nei ang ti te sa ta me cha asang bokani. Of course heng that na hi pa lo ti na ani lova amaro to ni pa ai chan me cha hen mo tam ani zo kan ti la ya ka ani ta. And then if the woman is living in a poor and social environmental circumstances, in education lo nei tlem lo nei nyam box si income nei sang box si lo I chung kwa ale nu pa in ka da har sat nei box si te chuanin real laman that na kan te kan say mental disorders nei na chance at sang mani ti like ka po mo low education, low income, low socioeconomic status, family and marital problems, all of those are very much can lead to mental problems like I can say the book. Then we also have some risk factors for mental health issues like gender-based roles kan nei khanin allow kan tha tho ina kan tha tho mi pa tho chi mi tho chi ya khan har san na kan lo nei khanin I allow mental health problems kan nei na chance sanga, and of course negative life experiences and events until now stressor kan ti hanin like COVID-19 is definitely a stressor kan til be tin I allow tum le pa ya kan lo nei lo te kan ru tot har sat na ru tot tup nei I allow har sat na nei khatang chi ya te khanin tin ba ka chi na lo khen te amo tum le pai din mona tlak chat lo khen te amo in chen na te alo khen te amo khatia nga te po khani har satna mental health problems ne chance at sa nei ta tin gender based violence hi karon se da thawa nge chani awanga ku thlak tor na chatte I allow khatia ang sia kha anita atin socio-economic disadvantages kan say to ta low income and income equality to kan say so to ta tin kan social status si apoy mo nei ta so when a person is at a lower social status rank then that person has a higher risk for mental health issues ila kan say tel do bokani tin ato bere mi apoy mo le zala ni tan swanin unremitting responsibility for the care of others midang te and call to shianin in thunga dam lo ta se in thunga har sa nei lo ta se atlang puin nu mo phurna hian kan ngai vek ta ni tutlai ka ra swanin I am thil pakhat karon se tel do tutlai a hian abi takin karon se tel do so mizo a swanin mizo community a swanin joint family kan lo war em ta ji han he kan lo ho tlang pui ta kum upate nen he ta kan pi le kan pu te nen lo pang lo tum sia thlengin ta kan ho dal ni tutlai ka ra san lo pang khatungi en kolang nu in ani ta upate khatungi en kolang nu in ani le ta ni so nga san en kol tu kha nu ani lai khanin a responsibility kha amo phorna kha sang em me ba ka khanin su sei lo ati tu ra kan ngai vek me ni tikak me tang ati tu ra kan ngaya ti lo se no swal kha ni dei ta har sa da te lo nei ve se lo dam lo se lo en kol hei lo ta se nula tlak plai lo kan ti le dei ta tin for example anti khalo omtani I am a board member of RC Mizoram chapter which is also called Alzheimer's and related disorder society of India Mizoram chapter hanin Alzheimer's ho enkol to te pola han patelani so 2021 lang yan MME so caregivers the ani chinta caregivers kan ti swan enkol to the Alzheimer patient enkol to the Alzheimer kan ti swan hey mizawa sanin na tar te kan ti me ta kung upato te na har sad na an nei kha ani ta ni an riru te amang tel tiala I an sha de te about tel tiala tin I allow enkol te an ngai thau ni ta ani lo so an mani ta na chale chalo tor pon thla sang thiam lo ta ti chuan an mani an ongrap tel tiala ti tang mi bang to enkol an ngai men enkol tel lo ton an nun na kha top me do la ti tang to enkol ngai man ni ta enkol na po hau takani sutlai ka ra chuanin enkol tu te hi nu te an ni tlang pu in chunga nu am chan nu te ni tlang pu ta tin I apasala pa te ama apasala nu te khalong ta ang se mo ano ni ang khan enkol ta amanu le pa tak po dilo an pa nu le pa ta kha amanu le pa angin alwanga avani ta ka wang khan ni abamo na khan enkol ta lo bangai le ta khatyang am in pe tak caregivers ni thwan athwalang tak me heroes caregivers and caregivers are actually heroes mo so khatyang khan om ta ni ma sa ta chuan kan shat tang to so Alzheimer patients at the po hian atang chuanin swalai hi an nei ve shim ta swalai kan ti me atong kam moi lo ya ma se hey an ma nya hianin an la hoi hom he do sia ma se shadna boy chan to a hianin I allow mi ti sang te an pu ta chin ta ni khatanga pu cha tan lo om khanin I allow an mani din hun ka ba thlir sang lo khanin chenam khawe nga te an mo te an rel du tlang pui ta ti kan se du a chan chu Alzheimer patients so ina tingi an mo te khan rel kan ti chuanin an mo te swal dang ni lovin Alzheimer patients san a shar reng zok so man lai nin kha a shatiang tiala tun nu ami kha shalo tia chin ta ni so man ka ho do te ti te hianin usually what happens is man lai an open la laya an inte kan ya ho na chin so apuitin no wa fa tu te thleng po nei no wa an in kha ina khan ngai thei lo ni so ma tu nu a thil thleng akum som ni nu mo akum som nga ani no wa kun alo thil thleng kha chetiang to lo khan khami ma zo kha ngai pa mo chin ta so ma mo te ka su kum upat to no wa ten lo nei alo ni na khanin khatlai ka ra khan mo te ka mission anga ngai te alo lian ta chin ta khan situation but here ni alo khan an mo te an lo ba rela an mo ten lo ba dem te khanin lo dem pui ve ne in mo no to lo ban sa la wi ka kren anga ni lo re de kan lo ti pui ha ro chin ta khatya tha kan or sam chin ta ni so an ma ni tan situation and mental health effect na sa dia kan se tel do ja wani so kaman jam ja wani Alzheimer sa khan because an mo phurna lem jate when she got married to her husband, I don't think she signed up to care for, you know, the Alzheimer patients. But however, it comes with the package. So mas ati turka ati meya, mas ati apo hanin chanam ko biang tapo hanin ya tung teng nge alo kai in tung ong de lo tapo hanin lo ba dem loi take an ol sam chin emme lai he yang tapo apoi china so major dinhun and it's can say look at the major dinhun so it's very difficult to care for other people when the other people keeps on blaming you then some of the common mental health problems that we have been talking about, I mean, I've been mentioned about depression and anxiety, and we have to talk about post-traumatic stress disorder, PTSD kan tita post-traumatic stress disorder the person may have gone through some traumatic situation. Har satna namen lo rapyak tak may antinan being raped any theta or say sakte any theta alo atak sa mo say sakte ariru emotional abuse lo ton to any theta ama kan har satna namen lo engem rapyak tak ka chung aro thengte or it can be earthquake a lot on amo it can be COVID-19 is also considered as a disaster. So disaster engeng malotan khanin alo aswa ka aton laya har sa nei sila mas aton no feya kum tam tak chung po khang alo har satna alo ton to tena zuya aril ru na sat tak asoi hinga amutte ele inte anun phung pandan to bang ati boy veka nightmare ka nei khan into the post traumatic stress disorder ania he tu point kan nei theya amaro kuni pala nei chat anyone kan nei thei ne to ti rala ro sam nei chan anasa ani ti lai kan sei do tin insomnia muthela muthai sat da hi ni chan asang e member ka tin alcohol use disorders ti alcohol ja karanda ta hanin I want to add like tunlaya pipanin antidepressant drugs ang site sleeping pills ate ka ta po hen mi chai kan sang ve thau ni ti lai ka sei nga ma set lai hanin I can say do me so based on my experiences because I've been working I'm also a board member of Volcom, which is the Volunteers for Community Mental Health. So we have been dealing with female sex workers for many years, and when we have interviewed like time and time again like our experiences with female sex workers is that we always ask them like why they started indulging in this particular role, and then at the same time we have also seen that Gema say about 99% or 99.9% I would say they have all have problems with either drugs or alcohol. So why are you using these substances? Why is this happening? Counseling local. They will first usually instead of the sex work, substance abuse comes first, and then in order to sustain their substance abuse, then they will go to sex work. And why did they started using drugs? And it's on women, female usually start using drugs to cope with some hardships that they undergo. It can kami itidam nanti in rihlo man anlo pang chinta and to mi pang chinna chang zuan a boy tluk ka anita this on car rihlo anlo ti akha and some lane allow the saying the silo ta a bit in drugs the unload the pay one in the tiny kang and some lane and some zon tina to ratan can and low lane to ratana some and more tina to ratan sex work account and culture tani so you can watch that. And during all our experiences with at Volcom about female sex workers, I have never come across even one single KS or FSW who says that she really enjoys being a sex worker. I have never come across that. Counselors, they have never mentioned even a single case where, female sex workers say that I really like this job until now. And then they will always have comorbid problems like depression, anxiety, things like that, besides the substance use disorders. So suppose ani beta ne tin to extreme version karon say ani meta mas extreme lawa lang si lawa pe chuanin ru na ti dam nan hianin me cha chuanin ri we among na chin ti la ya kha kan say tell the what like ka chuanin it can also be in terms of adu obya shim ka to anom lawan ni chuang lawan ne anom lu to thawani amaro so I allow atam zo ka say na ni to atam zo ka tin kan lo deal to te tanga history karon say na ani so tin mundanga say ngam si lo an pasal tin hai sab na an lo nei ta mundanga say chi angai si lawa mol phona lawa wang te afa te wang te mo ka ta wang kha shi amati a is like ka ra to ti nge na ashilova zu lo in arukin lo in tawar aruka lo in khato anwa khanin I angol veina boya lukha tan kha ol em me ni lai kan sei do so ba to ti chin hi achalovani o ti chin chang hen ngol veina an lut tlang pin ti kan sei do bakani to tani taksana ne te ka kan sei to ta and then abused women could twarte more emotional abuse upon yang so if you to see is well see the ansia in how tong na salu to te heng ho hi they are very likely to have mental problems which can also lead to suicidal tendencies so try ka ra mani in ti sum tum nate mani ma thi chak nate the mani in ti sum nate po kha na sa takin akheng the ni lai ha kan se tel do pokta sexual violence hianin sexual violence hi I don't know whether we have heard of intimate partner violence IPV tita so like ka ra domestic violence to kan shata in chung khura ku lehen na kha anita so like ka ra in chung khura and ku thaka te ka ta lehen te atware at omre so me thia hianin atwar to so me thia an tlang pu tan pa kha antor to thawala domestic violence the allow kan professor from Kiba Payton in Mizoram University of Payton a scholar pakatan in male nipa domestic violence twara kha an zirme kan ni mo interesting hel diawa I allow to nipa to tanga zir thamson on ve thawni ti la kan sei do amidora ti rale ro swanin atam wa ka ro hi to me cha an ni thawa the swanin heng hi allow nipa le me cha no pa an da win siam to hian in ngai zong to sei lo no pa po hian in marital rape hi Indian Penal Code swanin dana akhatla tani ti la kan sei do so to kan chalo chin ta no pa nim me wa ni pa khan adu do wa an no kha amut pui lawa kha kha athiang lawa an ni na adu lo swanin the woman has the right to say no the wife has the right to say no but when the husband refuses and then forcibly sleep with her that it can be considered as rape and this happens a lot. This is very, very high. So reported it goes many of the cases goes unreported and this can lead to difficulties in mental health and then so we have to understand that women have very little control over their sexuality and therefore they are also at a higher risk for acquiring sexually transmitted diseases like HIV/AIDS. Now, I don't know whether you have heard about HIV/AIDS. Biologically, female in terms of when we talk about STI, sexually transmitted infections. Okay, so they're having sex. Now, if the male is HIV positive, and the female is not, and once they have sex, the chances of the male transmitting the HIV to the female sex partner is very, very high. I would say it's about 90+%. However, a positive tase, mipa negative tase, that's one in mecha ina mipa avakai erokaso. Anyam the date tani. So biologically akan vandwai bang anita to the substance nature din hun ka adder thong big ani so just look and say do so anita must say katang kanin HIV AIDS positive the ka sorry 6 months to sang kanin I allow follow ta man to ni ti hakaron say song ba amar so this is what happens so we have to understand about a situation so wang tak one in gay the page one homosexuals are page one in men having sex with men are page one in it's like one time because they usually to down so like for sexual violence at the sexually transmitted diseases for him kan vandai wrong there and I think of course domestic violence the lifetime prevalence rate of violence against women it ranges from 16% to 50%. This is very very high for every person, so every woman. So at least 1 in 5 women have been raped or faced attempted rape in their lifetime, and the very high prevalence of sexual violence to which women are exposed and the corresponding high rate of PTSD following such violence, it renders the women the largest single group of people affected by this disorder. So usually PTSD it is usually caused because of a traumatic situation that the woman must have faced, and so PTSD case for basically it is because of gender violence. Violence against against them and then gender also determines differential power and control so men and women have over the socioeconomic determinants of their mental health and life. So he can say so also okay, coming to COVID-19 and mental health. COVID-19 I just wanted to have a bigger picture about gender issues and mental health and women. So one of the first thing that always comes to mind when it comes to women mental health is reproductive health. So reproductive health now COVID-19 situation preconception so unplanned pregnancy so COVID-19 COVID-19 because lockdown no ina adu wang renga mo no pa inkara do wang renga ni ma tung tang khanin I allow conception aka lo theng lo ka ong be theta sorry lo theng aka ong be theta so like ara twanin I nge ni danga anything unplanned pregnancies allow theng kan ti twanin the COVID-19 and lockdown na ran ti ta ka bang khanin contraceptive pills te amo I allow nge intrauterine ang treatment and sita engma ka abati theta lo bang khan doctor ta mu te ka ta lo ti theta ta ka bang khanin unplanned pregnancies ka asang phat em ta susanin har sa ta ron thlen be thena chan especially when the parents or when the family when that particular family affected is are not social are not economically sound. So economies and so bang sundin na har sa na ne pe ka wanin no te han om le khanin har sa na me lo ka ron thlen be the ni ti lai kan se tel so whose burden is that kan ti sa ba sa new burden kan le thau thau ta ni pasal ta ka sa an fel to thau nga mara so no kan ti to khanga twal dik ta chin ta no te care at the pe ka wanin then fertility issues sung sa he ka se to boka so tun lai khobela hanin nasa takin fertility problem ti asang em ta ni. And then I'm sure you must have heard or you must have seen people. I mean, of course, we see many couples blessed with, children in the early phase of their marriage life. But we've also seen many couples who have difficulty, having children. So fertility problems may fertility problems so to me ni bang twanin IVF te kan lo ta khatyang khanin treatment te now ani tin turata na treatment do lak ta kha khamtyang IVF te surrogacy te pon yang so IVF bi takin sel yang no pen kara to me ti do to an tam te em ta tin doctor treatment do lak te ti kha. Now, IVF treatment lockdown time, it's very, very expensive. So you have to spend like lakhs and lakhs of rupees. So ซึ่งมีไม่พอนี่แล้วว่ามีตัวเรื่องอ่ะ situation อ่ะแต่เพจว่านี่มีตัวเรื่องพอสิเห็นนะจ๊ะพอมินกันแล้วใช่แล้วว่า they go to the nearest place like Calcutta te Mumbai te other places in India katang aten local ta so number 1 ah son COVID-19 na bang son lo wai ta ni din chwa kha alo rem lo ta lo re tin vi the thang ma se COVID-19 kha kai na chance ka san dek ka wang han tu ma kan chwa gam ta lo da kan tom im ta tin ba ka tu nang din huna no teเขาเวลาเราลากหลวกค่ะมีตั้มตะกินอันน้ำจวงเราตานี่สุดที่ครบตอนอันเหาแต่เวกกันเหมือนกันเราถอกันเราอันเราเดือดทองตานี่ตินสุดรายการสุดตาตานี่ and couples who will try for IVF unbiological clock ค่ะallow ติ๊กเดียร์ใช่allow เดียร์ใช่ต่อ box เดียร์สมาสันนูค่ะอากุมค่ะอังไงตัวเดียร์เท่าค่ะอังไง box มั่วนาวไปตัวระดินมันเลยอาชีพเละไม่บอกกันอามากุมค่ะ because again women cannot be pregnant at all age kind of box here so one time kami issues nong so hangai ta lo ngai ta so kan transition kat ke ma le sha da ngai ta po those who had tried for those who were planning on trying for IVF they stopped trying because because of COVID-19 they cannot go anywhere and then since COVID-19 aron ken tel le kha ngai ni kha sum le pa har sat na kha lo ne ti so son expensive box an nam ta lo ta tin kumlo kum he kum khat le ti kan han boy le to box dia khat han kum kha local vessel box dia khang khan issues kha lo nei ve bokani ti la kan se duwa tin pregnancy now pai tum sang at po so we know that now pai lai te i ama khan vaccine la thela wan tan hoa vaccine la thele the ta dang kha kan boy ta sa ni kha because COVID-19 is so new mo thil tharalu to kalo ni box dia so like ka ra san now pai nu ina now a pai lai te pan har sat na shang tok thei din mana ading reng ta so like ka ra san ni to remote po so COVID-19 tel lawa alo ni lain COVID-19 shileng nen pe ka twanin har sat na men lo atok le zwa ta positive te engineer ni ang alo te effect ni ngam engineer lo in lawang alo ni kha na rai por positive an ni ta kan lau man ni kha tin point nei te he rai por te po i san te bok kan no nei ta COVID-19 na vangin mi dor ma nge po tang situation to pokan ne kha fear factor kami pena se ne me ni thon na ka min pena san me ni la hakan say the watching child but for we know that a very sad situation occurs in Mizoram again where a woman pregnant while delivering a baby a positive to see at the sana tizu ya the pokan han shata for yan me nen fate an no sen han kal san te an lein that oma an prefer ten lein that om tak sa din nu nun na kha mo shu me ya kha an lo kha kan ka han san te kha for yan me ta ni so wan san kam situation kha lo thing ve ta tin I an lo chal ba chu na khanin bakala tutani police station na bakala ka tanga I alo nge ni I thwa phel na ta kha I mo ta ang kha na ba la chang ta khan ni pa kha ta ang situation ta kha now ve to ka ra nen I kha tang ang har sat na ka pal chang kha lo ngai ta khan ra manga kon LLTF te na phone phata LLTF ten le kha thwa phel na te min lo pe ka mo odd hours ta pon ma te kha tang ti kha lo ni ta tu mang ton I alo kan free ta lo te me ni ti la kan se du wa tin dam do in khem pan lo te kha situation te khan ham the ta tu panin tristel na me ya la ma khan nin na ta na hlom tu te ka lo khem ta tin now apian nuwa po now piang lim I har sat na lo nei theya te po enkol na tha te po don thei lo na chance ka sang en na COVID-19 na wangin kan hlawa wangin I dam do ina ai twani ina hora ta ten no du ta tin no tristel na te po khan alo twai we thei bok ta tin now chat na te po kha like COVID-19 kha na sa takin I think again I connect bok ni la kan se do tin hem ya han no tristel na hi ashitel to ranga enkol na tha kha COVID-19 ka ra twanin adong ta to me ni athan so we know that hospital to uncarlo COVID-19 now must say who wants to go to the hospital all the time kind of that mainly I think all of us have a fear of going to the hospitals because we feel that the hospital is full of germs and bacteria and COVID-19 ka atamzok ang nga ina po kanne that so we become very wary so to say law akal na tur remote po ka motor no ni law tan pay so in taxi te eng ma tan box ni law ta so how to go ka ni ta ni so ka remote po ka bus te eng ma tan box ni law ta ka tyang remote man har second minute ten te ta so san tin riu ha ring COVID-19 na ta kan am ta riu ha ka now by tan twan ni nu now by tan san apoy men ni ta ni so twan ni now chat na po ka attend na chance ka law sang sa basta COVID-19 na le reproductive health di ka khalam ni ta ang se tin kan nun hi aron soi king ta aron soi dang lam tek ta ni tlai ka ra ta kan family life kan chung kwa ho dan te min tu boya ding so hun te min tu boya tho hun mu thun tu boya kan ni kha tin tlai ka ra twanin poi alo kan in chunga kan tom im na sa te me ta kan am ho na sa atira ta san nuam kan ti tu thau ma se kha alo lockdown kha akara thla akum maron ni ta I chu twanin rilu tot na le I alo again nun thong ab khai la ka wang khanin ril shong na kana ta kin min pe tin no pang en ko chu sa nga te na no pang te nge po in pon an do thak ta ka pon thwa lo tur kan do tia kum upa te I alo an lo khwa hara kan wat ngai sak man box si lo ta kan wa ngai to man box si lo wa ti ang si te ka tyang no sang khan tin pa ka in upa kum upa te en ko reng ngai ang si in thunga kan lo kol ten no pang en ko ngai reng angai ang si kan lo en ko ka tyang kan lo nei te khan pon thwa the mi asi lo 24/7 ka tyang kan lo ong ka tan kan ru tot na kha ati sang en men nei ta ni tu san depression the anxiety abi takin nei thia caregivers in the in lai akhan ang ti sang ta tin do pang zir na chung sang a hen kan si le do so har sadan na me lo aron thleng ta homeschooling chung sang a hian kan ti ngai lo alo ni ta ni kan han zir ta tu na ta po he mani in a tengin Champhai college thu ko sei de ta ni mo ai zo la tengin ka tang kan ti ngai lo zoom te kan ti I online class ta ti khat ti kan cha homeschooling chung sang a hian in kan se do do chum school hi kan senga ke mani po college po kan ni tho me theya I alo syllabus kan lo nei bok ki syllabus khat do shim ta kha de ti tam ta kan lo du kha lo ni ta khami ka ra khanin no pang tak stress kan lo penicillin ta kan lo je bak ta class han nei yan liang kan chutte lo nga ya ti twanin kha in lama kan sha reng tu nu le pa te tam ta kha zirna a lo pui the tu hi anom lem lawan ti ha kan sha ta pai mo ne ma se ka ti lai khan de tu ta kha san wa khan pe bak ta kan lo pe bak ta pui tin college so nu le pa ten pui ngai lo to ro kan ngai to ni kha tai ka lo in da chau la no pang school kan lai ni kan se so ti twanin no pang school kan lai ta wa kan han pe nu le pa ten an lo ti the tak chin si la wa chena la nu le pa ten an fa ten lo chang lo to an lo chan lo to na la ma khan an ma nen wa an fa ti an lo ti sak bok ta so wa to rin om na ta kan han ta tham pha ta tin alo har sat na me lo min pe zum le pa din hun alo in ang lova phone te thung kwa kha smartphone te no pang pathum o smartphone pa ni nu le pa ten lo nei the ta chon smartphone dang pathum kha school an han kal be kang box ti kha zoom class a shan chon lo nei phe kha ni what to do kha ni ta ni so tang a tan har sat na sum le pa ya pa har sat na me lo ta lo chen ta tin signal problem alo ni I alo he nang ma ni lama po ani chi na ma ka ringa ke ma ni to ni tho ta I do po na changa le kha rong zir kan ngaสุดรายการละตอนนี้เห็นอันเอเรียเป็นหันแต่ไม่หันหัวเจ้าที่หันริดไอหันอีอันเรา remote ตักกะเซนเราคัลแต่เราง่ายชินตา signal problem มันเนี่ยอีอันเรา current problem เราเนี่ยบอกตาขัดยังขันอีอันเรา problem har sa na situation kan talk ve ta ni an online classes a twan so no pong zo ka person har sa na ne lo an to ka no le pa ten stress level ka an dong ma sa to ta stress dong to zo to no ka ni le da bok ta ni tin no ka na to ka lo ni box si ka sa in la ma chang na lo tho bi tho ve tha lo ngai box si a fa ten lo om ve chen box si mo ka lai ka ra khan in lo len box si lo phe ka twanin I alo ta zoom class te internet to na ta pakin ta positive to kan ta ma se ke to ka sen khan pa ka nei la wan na ka ni ya ma se kan chan ta chen khat nu te to an fa ta ron lan ve se the na chak ta ka nom de ta ni tin in te lo len do phe ka twanin I space te lo kan lo nei tok lo ta ka chang han har sa ni ta pa lo chen the ta tin kan cham lo te po min pui tu ta ka an han wang ta sot ta in la ma chang na thor remote one and pui te men nei so domestic violence lo tok chang kut lo pasal te na mom an in chunga khát chẳng hay sợ là lâu tổ ăn lâu work te em lâu hậu te em lâu bên ăn khum te mà khát chẳng lâu tông chẳng khát toàn nhìn thì lockdown chung hết asal nè mà mình thấy cái độ bao cái domestic violence asal này tin sự ta substance abuse na chance asang boka lockdown as ina lo ang mat khatwani lo in to thang khatwan lo khoi to thang khatwani zel na chance ka sang sa anzo ta lo chin sa tum le pa ya har sat na ron thena unemployment na sa takin na theng bok sa tin heng zong har sat na karon sai hi single parent ni phepan ana sa zwal ta a double zel ani i tin I allow an ama kha ralban lo can punga ralban lo telo ni phepan ana sa zwal le bok ta tin no na talk working mothers tan phepan division of work kha mo avoid NMA ni athan so I allow hetia online na talk kha lo te ma ila in thung atanga online na thot so har sadya kan hotu te khanan siang mo no allow no te khan in siang mang khang kha ane ta ni tin I allow na kan han thoka unpaid work kha paid on lo na tor work hi no tan an na hi athok sa ni dile ha kan sai tele do kan so tin the studies have also shown that women contribute to 71% of the global hours of informal care. So informal care kan say jo to kha tin work-life balance has also been dramatically affected by closing schools and childcare centers. Nihi po yung napakaroon saya ka allow anita atin the pandemic has also increased the gender roles by imposing greater responsibility on the women, and researchers have also shown that gender roles in informal care are sources of distress and psychosocial exhaustion for women. Po yung mainly to allow tin hetyang unpaid care le unpaid work nasa taka allow hianin this can lead to mental health problems in the long term. So allow studies showing in aron parlan ta and then women and leadership in COVID-19 world hianin what we have seen is that frontline workers hianin media and tamani abi takin healthcare workers people media and some ta in allow tutukan halsaya ngay masen tamtok lang laba amaro supply sa kan sector women leaders please running tutluk siam na to ngani decision making lama sang mecha an sang lo bela thung da haga ko bela pan sang lo don se ka masi what we have seen so far in the COVID-19 world is that where there are women in the policy makers mecha and omkani they have demonstrated their skills and knowledge and networks to to lead their country effectively. So we know, some women prime ministers, the European countries are there, Australia are there. So we have seen like the kind of wonders that they have done. So just to confirm that thungsi so like our tuanin can share so they may chat tuanin may chat the book no may chat the book ka I allow din hun ka ashatyang and shatyang ta so me na man tuanin I allow may chat I allow nga itak na po aka may try to tuanin to at angyan ni aten ashatyam chinin I aba address ka har sa na po ka address nasa chin to kan lahat ang say doa so I allow the chat na zok chan po ani theya to kan chat tiama po yung atin they have shown their expertise in being very quick to respond to the lockdown situation, and so therefore they have lesser fatalities. So kan chat po yung tani now women but are the heads of state and government in only 20 countries worldwide. So there's so many countries in the world, and just 20 countries have women leaders. And remember, these women they have other roles other than being a leader of that country. And 70% of the entire global healthcare comprises of women. So healthcare tuanin may chat to ansang 70% and global amma ero to leadership roles they constitute only 25%. So asang law that mainly I talk at ang tamzo mas de atunay tinakaswanin za some hila pangata ka anige tong si ani. So but then we have seen that women heroes frontline workers over the past year, and then we also know that these women those who are frontline workers they have been balancing work and home, and lockdown also meant no household help. Mainly ina chanpri to nation naka alot lang yama fa te min en kol pui tu kha alo chan nyam bok ta tin skulan kal box di lo ina ho ngai box di mani na thot di thoma ngai box di kan di tani. And remember this, the frontline workers are risking their lives as well as the lives of their near and dear ones. And but for apyang kan an mani life me ni labin an beris ha an mani an sangayate an hole na turata an hole na tur hun an sian puitin nun kha an ngay din hun kha and to their thong zealand they have shut up. So they have helped to heal others at a huge cost of their own health. And man shriel na I ala poka nga isakhay thelo khopin midang shriel na tur kha boy queen and swakani. And so healthcare, WHO pays healthcare across the world is primarily delivered by women but led by men. At hialani, so gender pay gap pay ka say fail za kani ma mi pala he cha pay difference ka asang mem china ni tila kam say do bakta tin he ke mani rama nge po caution ate private ate po anyang sarkar ate hisanin mi pala he cha kan na ay antuanin kan hlote lawit nga amaro tu atamzo ano any informal sectors ate private sectors ate caution sectors ate panya tindoram ang atwanin gender pay gap and nasani. Then despite women making up the majority of frontline workers, there is disproportionate and inadequate representation of women in national and global COVID-19 policy spaces. So niletani policymakers akan mecha kan claim zel katwanin ni panana na san mecha ta bangai sak mecha har satna abit the reproductive health on ta base mani pan besi la ko san bashat kam ka lo har chin ta tin no din mana kan no ni besi la ko san bashat kam ka har chin ta ti la yang ta kan caregivers ni besi la ko san caregivers din man ka bashat kam ka ba empathize ta ka har ta so ma policymakers mecha on base la ka apoy mo na la kan ta lan tum na ani tani. Now this is what MC. So kan zo chapter now kasi reader has made min la siya mala ka so chapter ni the MC ahanin this is approximate tak kanin approximate avail ani na a person he may tia female healthcare worker si Dr. Rahian za som nga ver ani nurse na pin za som kole pare ver may tia ani lab technician ahan za som ruk ver ani group D ahan za som ruk may chan tam dia bani no may chan tam dia bani the MC apo the twanin he I allow unduty charge and Georgian Anita. It's like a nursing how duty dante, doctor duty dante, group D how duty dante, yang hindita. I allow the hand shift and calculate the person may tani, more the hand and rotate sir and high memory like the density tiny current land or like his son in his current lang zoya. Then just so that we can understand what they have been doing, what the kind of wonders they have been doing for us. And these are the workers at ZMC. So you can see them how they are working at ZMC. They have to wear the PPE. Ino hachin temino omsan pakatal hachin tem omsanin the inchetiam mayanga awap to jate. So the tahanin and PPE at hanin hypertension tapchin na on the kapsa and hani PPE hakshim mas remote wapo kan pahei thelo ma jime tur kapin har satna kan nei line tro anni te tyang an duty thong rong chang hi anita at ha PPE and ha mainly. So this is a picture taken by my cousin who is working at ZMC. So I asked her, who are these people, like, who are working here? Because they are PP in Harek Boxer, so you can't really know who they are and what they are doing. So she told me that since she can't see their faces and, it is very difficult to differentiate whether they are group D or nurse and me and group D and me for Champhai love the Arantine. So because hey, and Tiang Hanin, ayin tuam ngayin, and Oma, Tiang San, take off her in the allow Gantrisial Natante, and Ramtrisial Natante, and Toka, to attack to the Atamizok Metia and the Avangarunta Lankania. So, this is like, what we have been doing responding to COVID-19 pandemic in Mizoram. So, also kapona changte so hete kan don chinaka along chile ma also kan the zain he ta to point me take along the jang la kan lang ni so yeah. So as a part of our team, which is our COVID-19 Committee on Psychological and Social Guidance, and under this committee, we have a psychological counseling group where I'm the coordinator, and we have selected about 30 psychologists and clinical psychologists in Mizoram, in ISO, who can give psychosocial support to the people in need in relation to COVID-19. So last year, the committee started functioning since 1st April 2020, And then the psychologist group started functioning from May 1st to 2020. So last year, in all the quarantine centers, all the Sarkar run quarantine centers, then I would like to point out that, about 90% of the psychologists, about 95% of the psychologists are all with females, women. So we have been giving like psychosocial support to the children, to all the people who are there at the quarantine centers, and now to the 4C containment zones miran call swanin. So we give them to allow telecounseling second beya to not one second wave no one first wave we go to all the quarantine center if you look at this picture drawing here no pang artwork so we have an art therapist in our group. So an art therapist can no pang piang hi en call chin ta tiang swanin ama kai shwan no no pang second en call chin ta drawing te allow story writing te creativity person turatan te the shang pang khanin allow psychological support kan pachin bokani to kan trantar lang dia zai ni ha thanks for he allow kan tho dan ni zan la la to right te kha oma driver how te khanin allow so driver so te khanin no learn te khan antenna bang khan zan da kwa da som no ate den trauma hola te kan plan tha chan te khan kan kai ta tin hini kuma again the counseling quarantine center pakata counseling kan take down social distancing pa counseling kan take down te ani so anin atang pesan he pon ata kan omanga ya athung so quarantine center ani ta atihan pon ha kan psychologist pakata doctor mo yan ni hyap ne ani yan pon train counseling ani pe ani tin kan kal hianin what we usually do is we also try to give psychosocial care to the LLTF or to the frontline workers. So headline hanin kan Miss Julia clinical psychologist in how in mindfulness practice their relaxation therapy can make free line so this is how we actually have been giving our our services to the people of Mizoram or to the people of Aizawl. So what we have to for the last slide I'm sharing what we can do in order to help women. So let's understand that a woman's work is never done, so we have to keep on sharing the care. So kan nute unburden te kan lo lip pe thile turatan lo ba pui ve te lo ba chan pui ve te kha kan ti the angania in education apoy ma men ya thiam na tak nu ina ane thene tur me chena ne thene turin chan kan la theya to hi to point kan ti thei ni ti la ya kan sei do tin har sat me chani na awang te kan in te na awang te kan hoi her awang te me chani na awanga de riam na te thei te I allow mo thei nam na te kan lo tong kan lo mu chuan nui liam me lawa lo fiang ve me lawa lo tu ve me lawa kha hong ho te allow khatang to te kan lo hum hin thene turu tana chan lo lak te hi kan si ma mo ania tu kan si the ve kan ti la kan sei do poka tin equal work culture hi ngai to thar liang o ti la ya kha ni sa parental leave for if upon allow leave ani to mo kha now nu in an nu ina allow no te ani swanin paternity leave te poka on ve ro te mo lo na mo na po on ve thene tu win chan na thar te ang ata tu nu ringot tin en ko la kha atop po lo ve mo chan pri the ni ti la ya kha then now na te po hi apoy mo ani crutch te hi apoy mo me ni hi women and child development department here in social welfare janga peng sa te khani crutch tu na hian mun sang an boy premier ka so the positive angle wadi te kan nei chan zo rama pe san angle wadi ti HM mani then no ani swanin a working hours te ka flexible te to ta chan lo lak wi te in kan political rights te kan exercise thiam apoy mo ta me te din hun kan sha ta na nga ya ka se yang khani policy makers a me cha te kan yam thong song swan me da te din vorsan tak har don na to wan sanin allo vote te hi vote kan thak don han thak ya me lagin kan ngai twan te allo fin kan nei te pathai na fin na te mak chang ka ya me cha de din hun dom kang thei tu te kan lo thir thiam de hi apoy mo nei ta ni tin allo sum le 5 dan shop responsibly ka tin na kan sum le 5 dan tu ta ja team kurila thir thiamila tin me cha te hi an hlu ani mo me cha ani awang asit te adin hun allow anh nghe mấy chia alo ông về cắn lồng giờ thế anh nghe này ama sụt mất cái một chia mong tôi sụt bốc chi năng ở trang toàn nên ở trang tôi sụt về chi năng tin ý alo nghe trả remote thế ni là viên nun môi lệ trả anh này cả ý cắn đủ quý thế nó tụi nó tan chân cắn đầu lắc quý về thế anh ấy tôi hoàn toàn nên let's just not phrase ý nghe là thế thì riêng lệ remote cắn lâu phật quân mê là remote thế lần đó nè thì remote cắn phật chi nó tôi toàn nên affin na ti athiam na ti atak na ti ahwai na ti I allow leadership quality allow ni na ti mo ti tin I allow khatya khanin I kan lo fakchia ma kan lo toy moi thiam ka apoi ma em me ta ni tin beauty standards kan han ti let's challenge them and now because to get nail chap and so no te I Korean ang te khalo ni me the ta what's the beauty what is the meaning of beauty thing like what yang le ta ila just like ka beauty yala inner beauty poi mo ja lai te kha ko chak le ngam to chin ta ila se chak ngam to chin bok ta ila tin midang te I allow choice ka respect hiamang to jang to son chan kan do lak lan chuanin me te din mon hi I allow voi le khata dang lo hwain khen lo ma se I allow me te din mon kha I ma son je thela surata le do toy kana om je thela tun suratan nang le ke kha kan chang ve thini ti la ya kha kan se do ni a sikan tikhan wina karon se se to so ni se kalwa me
Thank you so much, Miss, for your interesting and informative presentation. It was truly enrich our knowledge through your expertise and researchful presentation. Thank you. Now we'll have discussions, and I request Miss to stay online and clarify our questions. In the meantime, let me read out our resource person curriculum detail. Dr. Larembwati is an assistant professor in the Department of Psychology at Government Aizawl West College. She had done her MA Psychology in Mizoram University, MPhil in Clinical Psychology in Manipur University, and PhD Psychology at Mizoram University, with the title of the thesis, Social and Psychological Factors of Drug Dependency, a study of Mizo youth. She had done many work experiences such as clinical psychologist, practicing since 2006 till date, and counselor and supervisor ICNU, Government Aizawl West College. She has been an assistant coordinator and coordinator of IQSC Steering Committee, Government Aizawl West College. Also, she has done many research works other than her academic, such as member of research team of Psychosocial Front, Mizoram Presbyterian Church in 2017 on the title work, Zoo in Mizotim in Hongdan Zirtiana, and member of research team of Psychosocial Front, Mizoram Presbyterian Church in 2019 on the title work, Leirol Tele Tharum Thona. Also, other than her academic professional services, she has associated with many memberships, which includes executive committee member of NGO, Volunteers for Community Mental Health, executive committee member of Mizoram Psychology Association, finance secretary of Alzheimer's and Related Disorders Society of India Mizoram Chapter, advisory board member, Mapuya Crisis Center, a center of mental health and suicide prevention, member of COVID-19 Committee on Psychological and Social Guidance, Government of Mizoram since April 2020, coordinator of Psychological Counseling Group under COVID-19 Committee on Psychological and Social Guidance, Government of Mizoram since May 2020, member of Selection Committee for Juvenile Justice Board and Child Welfare Committee under Social Welfare Department, Government of Mizoram, board member of Child Development Center, Mizoram since February 2021. Apart from that, she has been a resource person for various mental health and related topics in the state and local levels, programs organized by different NGOs and government organizations, as well as various media. And she has participated in various programs related to research, social science, and mental health. Let me check question. Oh, ma'am, Miss question has come. The hand question around Luta. So Miss can Milo clarify sak zel turing kan som ani question pakhat na chu clinical psychologist le psychiatrist danglam na hi enge ti ani
ale alam me psychiatrist chu anin MBBS azir phatangaya I ano doctor mo ani phatangaya the son MBBS azir ro khanin specialization course sang sang lo ta achen chu gynecologist nya chen chu medicine specialist nya ka tyang do khanin ka specialist course khanin psychiatry khanin and specialized ta kumthum I ano anjirta specialized course hen kum ni diploma tho bokta to psychiatrist ni dan sa ni doctor MBBS ni phatangai ni MBBS to zani class 12 science ni phatangaya MBBS nya san mi zo so zani psychiatry another 3 years kan ze le tani zani I clinical psychology thung zani psychology ka class 12 pa kan lo nei lo pan BA psychology kan lo nei to zani psychology honors in BA kan lo zera zani MA psychology kan zele Zanin clinical psychologist ze nitur Swanin MPhil in clinical psychology de care and ternan university shanga anjir nislem lo hospital setting hian kan tidwik ta to RCI Rehabilitation Council of India Ramatan Swan RCI Rehabilitation Council of India recognized universities allow MPhil in clinical psychology kan zele ta to another 2 years kan le ta to chang Swanin hospitals based in Kanzertani, allow Changswanin clinical psychologist ani theye or India Ramahun Shanga Zerna Omto.
Thank you. Son zona panhina hi Miss English in zona anya rem chandan ang khamin zel maidonya. As a woman, what do you think is the most important factor for providing a healthy environment among children?
Okay, among children, see, empathy is very, very important. Empathy is about understanding other people as they are. So, unmani bin hun bashat yam na ka empathy so ani. So, one children no pang te a twani bashat yam no pang te bashat yam na ka apoy mo Then, as a woman, I think it's also very important, or as a psychologist, I have to mention this because the child development part of the child is very, very important. I should say, na alo chandwan da na ka na sa takin athen ama mental health ka ashila wangin. It can be in terms of whether the child is having a good physical health. So the good physical health kanin achandwan hun pa ngai tu ra khan achang cha em e tu cha mo em I alo. So besides that, one thing very, very important for a child, I feel, is that the child feels safe in his or her environment. So when the child feels safe, the child will be happy. The child will become more healthy. So the child needs to feel very safe in his or her environment. So when I'm saying safe, I'm not just talking about physically safe. The child also has to be safe mentally. Aril ka him turani na huna kana him turani to him na twanin aman na kan nasta takin anun thung anu theng khan akai shai be tat me tani. So the first usually let me just expand on this answer because we tend to forget about the importance of the primary health life of a child, because so no pangkal especially when it comes to psychological problems, we tend to look at only the adolescents in curbing the chintani. Especially the first 5 years of a child's life is very, very crucial in making about the child's personality. So therefore, the first 5 years of a child's life is very, very crucial. So we should always take care that the child has enough food, enough nutrition, good nutrition, and then the child feels safe in his or her environment. So in the first 5 years like karon ngai pa mo so ani so
Thank you. Lo mem o so na he. Tốt. So du he. An mem o. So tu ne khat to ni an microphone to kan unmute tanga.
Oh Miss Asia them oh tikha din kanjot kanjot hal mai nga hemi kan kum azira kan psychology yang chi hi iron seme kan ril report mangai dinan kum khala tanga kum nga tele khatiang khami ka psychology an tension na ang chi hi omem ti kha khami kha mendo chang thengim bo chumi kum khala tanga kum ngang jin chu tiang ril ro chun puwa kum ro ka tanga kum somang je chon tiang chi classification kha.
Okay. So if you're asking me that kind of question, I have to go to child development the child development theory the theory to cognitive development this is where cognitive content not anything to do with the mental processes can truck chandan ka andita truck I'm not talking about the brain, I'm talking about kan thinking mo kan ngai twa dan chandan ka andita so that's one Piaget's theory can say chin lang pita John Piaget kanin atla chandan atwanin kum 0 to 2 years, 0 to 2 years ka around 10 na to 3 to 7 to 7 to 10 and then 10 to say roll 14 15 kan ka around 10 le tani so like ara around zyada na swanin kami each stage ha kanin no panghian kan thil shat dan te kan thil clear dan te kan shat thiam dan te adang lama atia so that's a bul thuta swanin 0 to 2 years so kan thil shat dan kan cover tem dan so kan cover la thil te kan shat dan swanin thil hi a khoi care kan sensation panga kan lo nei ta mita kan mu te benga kan shat te mo rim kan shat the na te kan ka asil kan shat the na te kan vuna kan thil kan shat the na kan feel the na te khanga chang khan thil kan chin ta tu chuanin shat na min pe so wang chuanin no pang chuanin angai chwa na po khang zong kha apang ta chin ta sensations mang khanin abul bel mi thil ka shat tum ta chin ta so wang chuanin no sen pon in mu chuanin thil ta po a chin ze lang asil mu ta kha a chin a zel kha a to le a lo to ta po kha kya sang thiam lok lo ta sa to wang chuan a kherte khoi kherte mo mu kherte kha ngai ta chin ta ni so wang chuan a sensation na ava mu lo kha chuanin ava shat lo kha chuanin thil kha sha ta lo chin ta chuanin no panga ran chang le ta chho ze ta kum hi aron pum sum ta kum hi no chuanin thil kha khovel kha ama thil na kha poi mo be shi mo the child is an egocentric being ati ni ama thil na chang lo ta thil a hu thiam le reng lo ta entina for example tlang lem hi lo entir ta la tlang lem chan tu na chan pui klinga chan tlang lem kha ilo en chan I mu the chin pia lam pang kha tlang kha omani ti kha I mu thia mang I mo lo chin lam pang asung lam pang apa tlang kha omang ti kha sia ang ma se no pang kha tang kum zat kha chuanin kha a mu chin ba kha engma kha om lo tat mai ni ama nu na chuan so wang chan egocentric ja a selfish ang khan kan nga yang so mo ama thir da chang cha khan thil engkim kha poi mo a mo so wang chuanin ani lo lo ma ti kha tanga so tin azir tir tu ten thil lo shil pya ta se an no ten ti tang ti lo da wanga ti tang pa so manga ti pa azir ti tu thu kha nga oil to me thei mo ka tang do kha ama do dan kha angai poi mo me ta ni to wang chuanin I ala Dr. John kan psychiatrist ti ta pe ka chuanin a che chin so I allow prince and princesses kan di patani ti mo to popular thau kha prince and princesses an thu ber ni I allow ka pa po kha ta sei chin na no pang om na tan ka leng pe lo ta nga ti remote control an thu an lo zel an ma ni thu lo TV and thilo ni no ba ti sin ha pyam to kan so om that so no pang ka thu and then maybe and kim ka ama thu ama thi na tlang so kan ta ma se kum sorry te kum sorry te ban ni so kha shanin thil om zia a shi thau ta a chu chanin I allow ama do than na te aron ngai poi mo thawa I tin I midang kha an nu na khan aron poi mo te em ta midang kha an ba mu thiam ba be ta midang ta pan ngai dan te clear dan te an lo nei ve ni te kan ma man thiam ta so wa chian kha an ngai ta ni chian kha an kom ngai te em ta lo chan income na tele tin ba ka lekha lama jirna te po kha ngai poi mo chota ma hun te kan thir thiam be chana te to an ron chang chol zela play role na chuanin play role a chon ma ni ngai dan ka han ngai poi mo le tam ba because thwa kharon aron team chho be chan ta brain development kharon chan chho le as pokta hormonal taksa khang mo te sang khan ron dang lam be le ta ka wang han kha khan na sa tin kan chwak ngai dan ngai to na kha mi ron kai shwai le ta tu chuanin I alo midang poka kan nuna khan poi mo ra khanin independent kha kan khel be le ta ni mo nu le pa kha ching chan te kha tang kang si ang ti te I alo tin chu mi pya la ma chuanin I alo kan enge thil om lo po kan clear thiama kan philosophical thinking te ka han nei tho be the ta ma kha kha ala the lem lo wa ni ma se control control development kan brain development kan aron support be to ta sumi ne wang chuanin kan ngai to te pok agril thau chan em me ta tin puitling ma se tlai ka ra kan has na kan lo tok pan le rol na khanin bakhat ma chuanin I alo I engkim te the anga kan nga ya kan alo kan special b no pe mani kan special b midang kha special lo ke ma ka special b so wang ka special b ka wang khanin I ka thoin ka tanga ta ho to kan ta tlai ka ra chuanin ri hlo boya kan ta na chan te po ani chin ta ni ka addict don lo ka tyang addiction ni to ma se te ro lan ka ti chin chang ve kan addiction of load mo so ma chuanin addiction la ka kha ilo fi big reng lo wa addiction la ka kha vian khan ilo ni ti kang ilo special vak lem lo mo khat la ya ka kan the hel ap kan lo the hel chin ta so ma chan thil kha ti the big cham the big ka kan nga ya ma se tlama achale la ya to thiam mo thiam the big ko mo chabi ko mo kan ngai na lai tak kha sports sa te mo musical ability sa te mo kan lo han chang kai thut kha ta in sa sham na cha chalut tuk ani ta ni so ma chan le kha thia zer to fa nga po thiam the big kan ngai cha ta in jirang mo kha ni na sa kai ke ma ni the ni na kha kan lo ne kha feeling kan ne na kha ni kha the ni ta ta kan chat na kha ni chang kai takin kan nun kha avhan bor sang dor the ta ni so if you look at sportsmen say among musicians turu tak te amo kan ta ilo lo thia ta la they have started from a very young age and they were like changa an lo bul chana kha mo changa at song total sa me ni kha na sa takin thiam na kha aron te kha ni thiam an white na wangin thiam na an luta and so ti chin na karon on ta white na ban an ti chin nam ta and so ti chin na son thiam na aron shai luta and so thiam na tan aron ken sen le so self confidence kan ya ta ni mani in dream talk ni se self esteem mo mani in mo san na te in mo san na ka ti khan ni chang in I an lo ngai am lam pang khan lo la lo la o mani in fruit na te in fruit thiam na te ka ta aron ta so san na sa takin an nun kal kunga kha kai shai de tla pe thawani so ban sanin kha ka le rol line na sanin thil chang na adang po am thaw ma se ase le to kang o tin khan do sa thang the chang thau chen
Oh, thank you, Miss.
Dang ala om en o. That is sense an. To lo chuanin interaction chu kan du talk anga now coming to an end for today's webinar. Before that, I may call upon Mr. Lalmal Soma, Assistant Professor, Committee Member, Equity and Inclusion Committee, to deliver a vote of thanks.
Le với nó hun hoi mo tak mai le lok thak tak mai kan manga lom thu soi tur tam tak kan ne ya ma sabera chuan pathian he na lom thu kan soya hun tha ni tha le hun tha te min pe a tin kan principal zom tak in hetiang hun man theina hun tha min pe te hi kan lo ma tin kan resource person Dr. Lalbem Ruati Dominizol West College assistant professor chunga po lom thu kan soya lok na tam tak kan charin arin oma tin zona le cham na te po thatakin kan nei theinin kan sia alom om khop maya tin hei kan committee hi kan committee member te le kan working chairman te kan secretary te chunga lom thu kan soi boka tiang hun ngai to chua theina thatak mai le resource person thatak mai kan han mu te hi alom om kan ti hlea hun le zela po tun lo adang po topic poimo tak tak le topic thatak tak te mangin tiang hun hi siam le te kan latuma chunga te po chuan min lo la troi oma min lo ngai thak subject tu te pon ngai thatu te kan han som chewa tuna khanin kan thungai thak te kha nge kan tham ral mai lovin apply thei ang chu apply ngal zel ni ta sela quote pakhat kan soive duwa hana gets b chuanin there is nothing stronger than a broken woman who has revealed herself atia laya chuanin hei kan nei sia te pon ni zorama ngei po din hun sang tak tak mai te kan lua chowa har satna tun ma kan har satna thin te kan ni zo dana kan har satna thin chut yani na om chho zela alom om hle maya ting hun tha kan mang thei hi kan lom em em ani ti kha kan soi du ni alom e
Thank you, Sir Soma, for your speech. And once again, I would like to thank our ICT, Information Communication Technology Committee in Government Champhai College for helping us to organize this program. Lastly, but not least, once again, I would like to thank our resource person for sparing your valuable time for today. And I hope our webinar for today will be benefited for all the participants. With that, we end up our webinar. Thank you all.
Thank you so much. Bye.
Thank you.